we'll be discussing some best choice questions or multiple choice questions of the topic of temporomandibular joint uh, with explanations of each and every option. So we'll start off with this question, which states that which one of the following is not a normal feature of temporomandibular joint. So the first option is pain in the related muscles of the jaw and neck. And the second is articulation between condyle and temporal bone. Then we have the gliding action, the hinge action, and both gliding and hinge action. So temporomandibular joint is an articulation between the temporal bone and the mandibular condyle. So, and there are two principal actions that take place within the temporomandibular joint, and this is the gliding action and the hinge action. So one way of solving this multiple choice question is to exclude all the right options. So we have excluded B, C, D, and E because all of these are correct. And so the only option that we have left is pain in the related muscles of the jaw and neck. Now, explanation for this is that temporomandibular joint, the normal function of temporomandibular joint usually is not associated with any pain, and it shouldn't be painful, whether it's eating, chewing, or opening or closing of the mouth. Any of the function of temporomandibular joint should not be associated with pain. Okay, so now this question is the second question is which of the following structures divides the temporomandibular joint into two? So we have the right and the left condylar heads. We have the articular disc, the capsule and the supportive ligaments, the temporal fossae, and the articular eminence. So we'll look at all of these structures one by one, and then we'll decide what the answer to this question is. So this is the temporomandibular joint. So, and this is the articular eminence of the temporal bone. We have the glenoid fossa in which we see the articular disc, and then we have the condylar bone. So as you can see here, the articular disc, it actually divides the glenoid fossa into two compartments. The upper compartment are the upper joint space, and the lower compartment are the lower joint space. So the right answer to this question is that the articular disc actually divides into two compartments. So so the right answer is the articular disc. Now we'll move on to the next question. So temporomandibular joint belongs to which of the following joints? So we have the fibrous joint, the cartilaginous joint, the synovial joint, the sternocostal joint, and lastly the spheno-occipital joint. Now temporomandibular joint is unique as not only does it have a synovial membrane, but it has synovial fluid in it, and it has a fibrous cartilage in it as well. Usually most of the synovial joints in our body are cartilaginous in origin, and they have a hyaline cartilage that supports the joints. But temporomandibular joint is the only synovial joint that has fibrous articular cartilage. So the right answer to this question is that it is a synovial joint. Okay, so now we'll move on to the next question. These are related to unusual feature of temporomandibular joint. An unusual feature of temporomandibular joint is that interarticular disc divides the joint cavity into two joint spaces: the synovial joint with synovial fluid and synovial membrane. And the third option is it has muscles and ligaments supporting it, and it has a primary and secondary cartilages are present in temporomandibular joint, and it is affected by osteoarthritis frequently. So we'll try to discuss each of the options here. So we'll start with the last one. It is affected by osteoarthritis. Usually temporomandibular joint is not affected by osteoarthritis, and you can really see any dysfunction because of osteoarthritis in the jaws. uh, and even rheumatoid arthritis doesn't have uh, any loss of function in the temporomandibular joint. Now, as far as primary and secondary cartilages are present in the temporomandibular joint, we have the condylar cartilage and it's a secondary cartilage. So it doesn't have any primary cartilage as such, and it does have muscles and ligaments supporting it, and so um, the same goes for each and every joint in our body. All the joints in our body are supported by muscles and ligaments, uh, and most of the joints of our hand and feet are synovial joints, and they have a synovial fluid and synovial membrane. So we are left off with the first option, the interarticular disc that divides the joint cavity into two joint spaces. So temporomandibular joint is unique in the way that it has an interarticular disc that divides the joint cavity into two joint spaces, and this is the only joint in our whole body that is actually divided into two spaces by an articular disc. So, so the right option is that that has an interarticular disc, and it is unique that it divides the joint cavity into two joint spaces. Now, a little bit about the articular disc. The articular disc, although it is a single articular disc, but it has three portions or three zones that are discernible in this articular disc. The first is the anterior border, and then there's an intermediate zone, and then there's the posterior border. And the posterior border is then confluent with retrodiscal tissues. The posterior border is the thickest, and the intermediate zone is the thinnest, while the anterior border is intermediate in between. So it actually works as the analogy that used here is just like a pillow. So the head of the condyle, it rests snugly in the intermediate zone, next to the intermediate zone, and this is the area where this is known as the centric relation, where the condylar head is resting on the intermediate zone of the articular disc. So we'll now move on to the last question, and that is a unique feature of temporomandibular joint. So this is another unusual feature of temporomandibular joint, that its movements are influenced by teeth, synovial joint with synovial fluid and synovial membrane. It has muscles and ligaments supporting it, and similar to the previous one, it has primary and secondary cartilages that are present, and it is affected by osteoarthritis frequently. So all of the options are incorrect except the first one, that is the only joint in the movement of which is influenced by teeth. So the right option is that the unusual or unique feature of temporomandibular joint is that it has the teeth, and the teeth actually provide anterior guidance to the movement of the temporomandibular joint. So thank you everyone.